Hello, my name is Malia Richmond-Crum, and I'd like to welcome you to a CDC stakeholder call within a series we're calling Helping Communities Plan for, Respond to, and Recover from the COVID-19 Pandemic. Today's call is focused on youth programs and camps. And before we begin, I'd just like to start by saying thank you. Thank you all of us for joining us today and for all that you're doing to protect people in your communities, including youth, during this unprecedented time. A few housekeeping notes before we begin. Unfortunately today, a live transcription of this call will not be possible. However, the webinar is being recorded and will be posted on CDC's COVID website, and that recording will include a transcription. Additionally, this call is not intended for the media. Media can direct their questions and inquiries to media@cdc.gov. Our plan today is to hear a situational update from a leader in CDC's COVID-19 emergency response, followed by details on youth programs and camps from a CDC subject matter expert. We'll then have time for questions and answers based on the questions submitted in advance by email provided in the stakeholder call announcement that you all received. I'm very pleased today to be joined by Drs. Carolyn Wester and Janet Fulton. Dr. Wester is the director of CDC's Division of Viral Hepatitis within the National Center for HIV, Hepatitis, STD, and TB Prevention. In this role, she oversees the design and implementation of national programs for viral hepatitis prevention, control, surveillance, and outbreak response. Dr. Wester is currently supporting CDC's COVID-19 response in the role of Deputy Incident Manager, which includes oversight of the Community Intervention and At-Risk Populations Task Force. Dr. Janet Fulton leads the Community Guidance Team in CDC's COVID-19 Community Intervention and At-Risk Task Force. When she's not working to lead COVID-19 mitigation efforts, Dr. Fulton is the branch chief of the Physical Activity and Health Branch in CDC's Division of Nutrition, Physical Activity, and Obesity. We're also joined today by Dr. Jennifer Murphy. We know a lot of folks have questions related to cleaning and disinfection during this pandemic. Dr. Murphy is the team lead of the Water, Sanitation, and Hygiene team within CDC's COVID-19 response. Outside of the response, she serves as CDC's Environmental Microbiology and Engineering Laboratory team lead in the Waterborne Disease Prevention Branch. I'll now turn things over to Dr. Wester to share a situational update on the response.
Thank you very much. This is Carolyn Wester, and I'm pleased to provide you with the situational update. Across CDC, we're working closely with the White House Coronavirus Task Force and other federal partners to slow the spread of COVID-19 and ensure communities remain safe, healthy, and resilient. Currently, 57 jurisdictions, which includes all 50 states, DC, New York City, Northern Mariana Islands, Guam, Puerto Rico, US Virgin Islands, and Navajo Nation, are reporting COVID-19 cases to CDC. As of today, there are nearly 1.5 million confirmed and probable cases and over 90,000 deaths in the United States that have been reported to the CDC. CDC is actively engaged in the whole of government plan to get and keep America open safely and efficiently by providing critical information about COVID-19. CDC is also providing direct and tailored technical assistance to support state, territorial, local, and tribal health departments as they consider approaches to slow the spread of or mitigate and contain COVID-19. Mitigation and containment of COVID-19 is essential to get and keep America open, and CDC is committed to leveraging our expertise and partnering with others on the front lines as they make decisions about when and how to adjust community mitigation efforts. CDC is continuing to provide guidance and implementation tools to assist state and local partners and other stakeholders in making decisions about adjusting mitigation strategies to protect public health. I am pleased to note that CDC has published a variety of resources to support reopening efforts. These range from decision tools to updates to the document titled CDC Activities and Initiatives Supporting the COVID-19 Response and the President's plan for opening up America again. This includes 2 new appendices to assist public health and government officials in making decisions on when and how to reopen communities and specific settings. There's currently no vaccine to prevent COVID-19. The best way to prevent infection is to avoid being exposed to the virus. CDC recommends taking steps to help prevent the spread of COVID-19, including avoiding touching your eyes, nose, and mouth with unwashed hands, avoiding close contact with people who are sick, staying home when you're sick, covering your cough or sneeze with a tissue and then throwing the tissue in the trash, wearing a cloth face covering in public settings where social distancing measures are difficult to maintain, clean frequently touched objects and surfaces using soap and water and then disinfect using a product from EPA's List N, which is disinfectants for use against SARS-CoV-2. And washing your hands often with soap and water for at least 20 seconds, especially before eating or preparing food, or after blowing your nose or coughing or sneezing, or going to the bathroom. And if soap and water are not readily available, using an alcohol-based hand sanitizer with at least 60% alcohol. Social distancing, such as maintaining more than 6 feet of physical distance between people in community settings and staying at home, is strongly recommended as well. With that, I'd like to turn it over to Dr. Janet Fulton, lead of the Community Guidance Team within CDC's COVID-19 Community Intervention and At-Risk Task Force. Janet?
Well, thank you, Dr. Wester. We know that there are a lot of questions and concerns related to youth programs and camps at the moment. Many schools are closed for the rest of the semester, and parents, teachers, and others are starting to think about what this summer will look like for their communities. As Dr. Wester noted, last week, CDC posted new tools that, along with other CDC guidance, assist directors or administrators in making mitigation decisions regarding youth programs and camps during the COVID-19 pandemic. I really want to emphasize that adjusting community mitigation strategies doesn't mean that the COVID-19 threat is over. It really means that some amount of community mitigation is necessary across all steps until a vaccine or a therapeutic drug becomes widely available. It's also important to recognize that each community is unique, and as such, decision-making will vary from locality to locality. Decisions should be made in collaboration with state and local health officials and other partners to meet the unique needs and circumstances of the local community and to ensure that decisions align with state and local orders. Strategies should be guided by what is feasible, practical, and acceptable, and should be tailored to the needs of each community. Multiple safeguards can reduce the spread of COVID-19. But it's really just like the layers of protections that exist when we're driving our car. This includes strategies that each individual can take, such as using your seatbelt, as well as environmental strategies such as obeying speed limits and policies such as driver's license tests. If you stack those best practices, we know that there have now been several layers of safeguards to reduce the spread of COVID-19 and lower the risk of another spike in cases and deaths. It's necessary to do this to manage this pandemic. So now I'd like to turn to youth programs and summer camps and really talk about them. There are a number of actions that youth camp administrators may consider to take to lower the risk of spreading COVID-19. And these actions really fall into 4 categories. Those 4 categories include promoting behaviors to reduce the spread, maintaining healthy environments, maintaining healthy operations, and preparing for when someone gets sick. So let's talk now about strategies that camps may consider to promote behaviors that can reduce the spread of COVID-19. First, we really want to educate staff, campers, and their families about when to stay home if they or someone in their household is showing symptoms of COVID-19 and when it's safe to return to camp. Camp directors and administrators should encourage campers and staff who are sick or have recently had a close contact with a person with COVID-19 to stay home. CDC has criteria to help inform when employees should return to work and information on what to do if you're sick and guidance on when you should end home isolation. Also, we know that camps and camp administrators should teach and reinforce healthy hygiene, like frequent hand washing and covering coughs and sneezes. Camps can teach and reinforce also, very important, the use of cloth face coverings. These face coverings, we all know, can be challenging for campers, especially younger campers, to wear in all-day settings such as a camp. Face coverings should be worn by staff and campers, particularly older campers if feasible, and are most essential in settings where physical distancing is difficult. We really want people to note that face coverings may be challenging for campers, especially these younger campers, or campers with sensory, cognitive, or behavioral issues to wear in all-day settings such as camp. And really important, face coverings should not be worn by children under 2 years of age, people who have trouble breathing, or people who are unable to remove the covering without assistance. So that was the first bucket. The second bucket is really about maintaining healthy environments, and that includes a lot of different strategies. Let me just go through a few of those. To maintain healthy environments, we want camps to have adequate supplies on board to support healthy hygiene behaviors, including soap, hand sanitizer with at least 60% alcohol, paper towels, tissues, and no-touch trash cans. They should also post signs on how to stop the spread of COVID-19, properly wash hands, promote everyday protective measures, and properly wear a face covering. Camps should clean and disinfect frequently touched surfaces, including playground equipment, door handles, sink handles, and drinking fountains. Camps should minimize the sharing of high-touch items like electronic devices, toys, books, and athletic equipment. They should also use individually labeled containers or cubbies or designated areas and ensure adequate supplies to reduce sharing of high-touch items. Camps should also consider modifying the layout, such as by spacing seating 6 feet apart, placing campers head to toe during nap time while they're sleeping, and increase space between occupants on camp vehicles. Very important to try to spread people apart, at least 6 feet. And also, we can help by in placing physical barriers like tape on floors or sidewalks, or having one-way routes in hallways. This can help staff and campers distance themselves. Camps may also consider closing shared spaces, such as dining halls and playgrounds, to reduce the spread. If it's feasible, they can consider asking campers to bring their own meals or provide pre-packaged boxes or bags instead of buffet or family-style sharing at mealtime. The third set of considerations are related to maintaining healthy operations. This is the third bucket. There are several strategies here as well. Camp directors and administrators should consider offering options for staff or campers at higher risk for severe illness, like older adults or those with underlying medical illnesses of any age. For staff, this might include telework or modified job responsibilities, and for campers, this might be virtual learning opportunities. Keeping campers in small groups with dedicated staff, making efforts to stay within the same group throughout the day, and limited mixing between groups when possible can help reduce the spread. This is often called cohorting. Camps may also consider staggering arrival and drop-off times or locations by group, as well as limiting group events, gatherings, meetings, non-essential visitors, and field trips. And also implementing daily health checks, such as temperature screening or symptom checking of staff and campers, should also be considered where feasible. And finally, that fourth bucket is making a plan for when someone gets sick. We want camps to make sure staff, campers, and families know that they should not come to camp and that they should notify camp officials if they become sick with COVID-19 symptoms, if they test positive for COVID-19, or have been exposed to someone with symptoms or confirmed or suspected case. Camp should also designate an isolation room or area to immediately separate anyone who gets COVID-like symptoms, including fever, cough, and shortness of breath, and immediately separate someone showing these symptoms. Camps should establish procedures to safely transport anyone sick to their home or to a healthcare provider will also be important. We know that also sick staff members or campers should not return to camp until they have met CDC's criteria to discontinue home isolation. And then also, camp administrators should notify local health officials, staff, and families immediately while maintaining confidentiality if a camper or staff member is identified as having COVID-19. And finally, I want to talk a little bit about some additional considerations for sleepaway camps or overnight camps. And these are fairly common types of camps. Camp directors should consider several things. They should limit camp attendance to staff and campers who live in the local geographic area, for example, the city, the town, the county, or the community. Thinking about sleeping accommodations, important to align mats or beds so that campers and staff sleep head to toe at least 6 feet apart when feasible. Also adding barriers, physical barriers, such as plastic flexible screens between bathroom sinks and between beds, especially when they cannot be at least 6 feet apart. Encouraging staff and campers to avoid placing toothbrushes or toiletries directly on counter surfaces, and really making sure to clean and disinfect bathrooms regularly. I really very much appreciate the opportunity to share these important considerations for camps and youth program administrators today, and I thank you all for your time and all that you're doing to prevent the spread of COVID-19 while keeping your campers, your staff, and their families safe. And now I'll stop here and turn it back to Malia to facilitate our question and answer session.
Thank you, Dr. Fulton, and thank you, Dr. Wester. We had a lot of questions that came in. Thank you all for emailing those to us, and we'll just kind of dive in and get started talking through what issues and concerns you all have that we can help answer. So the first question we have, I think, is for Dr. Murphy, and folks are really interested in, what is the frequency that cleaning and disinfection of high-touch surfaces should occur? At what frequency should that occur?
So surfaces frequently touched by multiple people, so this includes door handles, tables, light switches, or bathroom faucets, should be cleaned and disinfected at least daily. We also suggest that more frequent cleaning and disinfection may be required based on the level of use. Really, each facility is unique, so camp directors and administrators should work together to assess these high-touch surfaces in their facilities and to develop a schedule for cleaning and disinfecting that is tailored specifically to that setting.
Thank you. So relatedly, we had some questions that got a little more specific about what needs to be disinfected. So another question that we received is, what is the frequency that disinfection of toys and other materials, similar materials, how often should that take place?
So there are a few things to consider when cleaning and disinfecting toys. First, I just want to go over some terminology to be familiar with. So cleaning means using soap and water to remove dirt and debris, and this can also decrease how much of the virus is on the surface or object. So cleaning should always be done first before using either a sanitizer or a disinfectant. A sanitizer is a product that also reduces the amount of germs on surfaces to levels that are considered safe by certain public health codes or regulations. Sanitizers are used for toys that children may place in their mouths, and they're also used on food contact surfaces. And then a disinfectant is a product that destroys or inactivates germs or on objects or surfaces. So CDC recommends the use of disinfectants on the Environmental Protection Agency's list in. So this list includes about 400 disinfectants that are effective against the virus that causes COVID-19. And please just remember, disinfectants should not be used on objects that children might place in their mouths, as many of these disinfectants are toxic when they are swallowed. So in terms of frequency of cleaning and sanitizing or disinfecting toys, the first step is to identify which toys cannot be cleaned and sanitized or disinfected, and those toys should probably just be taken out of use. CDC recommends that toys should be frequently cleaned and then sanitized or disinfected, ideally between use by different children. So again, you'll want to use water and detergent to first clean, then rinse, sanitize or disinfect with one of these EPA registered products, rinse again, and then air dry. And you may also be able to clean toys in a mechanical dishwasher, depending on the type of toy that it is. Machine washable cloth toys should be used by one individual at a time, or they shouldn't be used at all. These toys can be laundered before being used by another child. And then just a couple of other safety things to note. Cleaning, sanitizing, and disinfecting products should not be used in close proximity to children, and adequate ventilation should be maintained during any cleaning, sanitizing, or disinfecting procedure to prevent children and caregivers or teachers from inhaling potentially toxic fumes. Cleaning materials should be kept secure and out of the reach of children. And it's important to make sure that you follow the manufacturer's instructions for all cleaning, sanitizing, and disinfection products. So for example, the concentration that you use and the application method and the contact time. And it's important to also make sure that you use the proper personal protective equipment for application of these products. So you can find more information on cleaning and disinfection of toys and other surfaces in the child care program setting of CDC's guidance for child care programs that remain open.
Thank you. I think that was incredibly helpful. And I know there are a ton of questions about cleaning and disinfecting, so thank you very much. Our next question is for Dr. Fulton. And could you please address special needs populations and how they will continue to be included in youth programs and camps? Many camps are limiting registration this summer, so we want to ensure that all children have equal access to limited programs that will be offered.
Yeah, that's such an important question, an important issue. It's really vital to provide children with equitable access to youth programs and camps. It's such a positive experience for them. For campers and staff with special needs or those who are higher risk of severe illness from COVID-19, you can consider a few things. For children, consider offering options for campers and adults at higher risk for severe illness that really limit their exposure for risk. So for kids, you can have them do virtual learning opportunities. And for adults, you can think about modifying their job responsibilities or allowing them to telework. For camping staff, offering options for staff at higher risk for severe illness that limit their exposure risk, again, is a really great strategy. For staff and campers, can limit their camp attendance to those who live in the local geographic area to reduce that spread across higher levels of localities for COVID-19. And they can also put in place policies that protect the privacy of people who are at higher risk for severe illness regarding their underlying medical condition.
Great, thank you so much. I think the next question is also for you, and that's around testing. So should camps test all campers before they come to camp?
Excellent question. The CDC clinical criteria for considering testing for COVID-19 has been developed based on what's known about COVID-19, and it's really subject to change as additional information becomes available. Camp administrators should establish and maintain communication with local and state authorities to determine current mitigation levels in your particular community. Clinicians considering diagnostic testing of people with possible COVID-19 should continue to work with their local and state health departments to coordinate testing through public health laboratories or work with commercial or clinical laboratories using diagnostic tests authorized for emergency use by the U.S. Food and Drug Administration. So currently, CDC has identified the following groups of high priority for nucleic acid or antigen testing. And those are hospitalized patients with symptoms, healthcare facility workers, workers in congregate living settings, and first responders with symptoms. and then also residents in long-term care facilities or other congregate living settings, including prisons and shelters. Those priority groups include persons with symptoms of potential COVID-19 infection, including fever, cough, shortness of breath, chills, muscle pain, a new loss of taste or smell, vomiting or diarrhea, and or sore throat. Persons without symptoms who are prioritized to health departments or clinicians for any reason, including, but are not limited to, public health monitoring, sentinel surveillance, or screening of other asymptomatic individuals according to state and local plans. And again, I want to reiterate that CDC guidance for COVID-19 may change and guidance may be adapted by state and local health departments to respond to rapidly changing local circumstances.
Thank you. So we've also been getting, we received a number of questions ahead of time around cloth face coverings. There are also questions in the chat box, in the Q&A box related to this as well. So I think just generally, could you cover some information about should campers wear cloth face coverings? And specifically, I know in the chat box, folks had asked about cloth face coverings across the whole day a camper may have in camp. What about sleeping? These type of different activities during the day where they may or may not have to wear a face covering. Thank you.
It's a really great question and a question we get quite a bit. Cloth face coverings are meant to protect other people in case the wearer is unknowingly infected. So I protect you, you protect me. However, the face coverings, particularly for children, you know, may be challenging for campers to wear in all-day settings, especially among younger campers. So really, when feasible, staff and campers, particularly older campers, should wear those face coverings. We really want them to do that, especially when physical distancing is difficult, when you can't stay 6 feet away. But camps should provide to staff and campers instructions on how to properly use and remove and wash the cloth face covering. It's also really important to understand that face coverings should not be worn by everyone. They should not be placed on babies or children younger than 2 years of age, on anyone who has trouble breathing, including those people who have asthma or if you're unconscious, anyone who's incapacitated or otherwise unable to remove the cover without help, and anyone with extreme anxiety related to the use of cloth face coverings.
Thank you. So we also received questions about how long SARS-CoV-2, this novel coronavirus, can survive on different materials. So if we could get some information about how long it could survive on clothing. Additionally, people in the chat box are asking about how long it might survive on blankets or stuffed animals. I think that information would be very helpful to folks.
Sure. So there's still a lot we don't know about this virus. There's really just not a whole lot of data available on clothing or other types of objects, like blankets and toys. But we do think that it's unlikely that there's prolonged survival, especially on active wear clothing, other types of clothing. So we do know inactivation likely occurs within hours to days, and this is based on a couple of studies that have recently come out on different types of surfaces. But to date, there have been no documented cases of transmission of the virus from clothing or shoes.
Thank you. And so should campers be allowed to play on playgrounds and use other outdoor equipment? And then again, how should this be cleaned if they do?
Sure. So outdoor areas like playgrounds and schools and parks generally just require normal routine cleaning and don't often require any disinfection steps. Although you can consider doing some disinfections, some targeted use of disinfectants if it's done effectively, efficiently, and safely on some outdoor hard surfaces and objects that are touched frequently by multiple people. Again, this is location and situation dependent, and it really should be determined when camp directors and administrators assess their facilities and develop a schedule for cleaning and disinfecting that's really tailored to their setting. We do get a lot of questions about sidewalks and ground covers. Cleaning and disinfection of these types of areas really is not recommended. We don't see it as an efficient use of disinfectant supplies, and it hasn't yet been proven to reduce the risk of COVID-19 to the public.
Thank you. So Dr. Fulton, we have a question for you. Are children with conditions such as type 1 diabetes considered higher risk for severe illness? Would it be best to keep these children at home from camp?
Sure, that's a really great and important question. You know, I've had the privilege to take a friend of ours' daughter to camp for the camp for kids with Tourette syndrome. That's been a highlight of our summer every year. And so I first want to note that this is a highly personal decision, and it's not an easy one. It's really important to consult with your healthcare provider for advice on your special circumstances. What we know is that people of all ages with underlying medical conditions, particularly if not well controlled, may be at higher risk for severe illness. I really want to emphasize that we're still learning about how COVID-19 affects children. Based on available evidence, children don't appear to be at higher risk for COVID-19 than adults. While some children and infants have been sick with COVID-19, adults make up most of the known cases to date. And children with confirmed COVID-19 have generally showed mild symptoms. But it's not known yet whether some children may be at higher risk for severe illness. For example, recently we've begun to see this multi-system inflammatory syndrome in children that resembles a disease like Kawasaki's. While this still seems rare, it's serious, and it points out how much more we have to learn. But, you know, in the meantime, there are steps that any parent can take to help their children stay healthy and stop the spread of COVID-19. These are things that we've talked about already. It's so important to take steps to protect children and others from getting sick. So make sure they clean their hands often, avoid people who are sick, clean and disinfect high-touch surfaces daily, and launder items. Also, limit time with other children, practice social distancing. You might even have to alter your travel plans. Really important to limit time with older adults and people with serious underlying medical conditions, and children 2 years and older should wear a cloth face covering if feasible. So apart from the health risk posed by COVID-19, there may also be other factors to consider as parents and caregivers make this decision about sending their child to camp. They also need to think about job requirements, the ability or inability to work from home with your child or children. Of course, the mental health of your family, your child's need to socialize with peers, the need for all of our children to learn in a way many of us parents feel inadequate to provide, and probably some additional factors that are unique to each child and family.
Thank you, Dr. Fulton. And you mentioned this new multi-system inflammatory syndrome in children. Could you talk a little bit more about that? We did get a number of questions from people about this new condition that's been in the news and affecting children.
Sure, yeah, for sure. Well, yeah, CDC is concerned about the emergence of a new syndrome called Pediatric Multi-System Inflammatory Syndrome, or PMIS, and the potential association with COVID-19. At this time, as more data are emerging, CDC is working with domestic and international partners to better understand and characterize this new syndrome, its prevalence, and its risk factors. On May 14th, CDC issued a nationwide health alert to clinicians with background information on this syndrome and a case definition. So now we're asking all healthcare providers to consult with state, local, and territorial health departments on any patients who meet the criteria. This is a rapidly changing situation. It's evolving, and we will continue to share the latest information with the public as new information and new evidence emerges.
Thank you. And I also know that earlier today, CDC hosted a clinician call on this syndrome, and that webinar was recorded and will be posted on CDC's website as well. So there's more information on CDC's website regarding this issue. So the next question we have is for Dr. Murphy. Is there a potential risk for spreading SARS-CoV-2 in and on untreated recreational water, such as rivers and lakes?
Yeah, that's a great question, and one that we've gotten a lot lately as the summer is rolling around. So there's no evidence to date that the virus that causes COVID-19 has spread through recreational water. So at this time, the potential risk for COVID-19 transmission while recreating in or on these types of surface waters, so for example, swimming or boating, is thought to be low. But we still think it's important to consider steps for camp directors, administrators, and really any of the kids who are recreating that they can take to protect themselves and others. So again, the social distancing, washing hands, the cloth face coverings, the cleaning and disinfecting surfaces. So those should still, I think those are still really important for those to continue. And CDC is reviewing new data on COVID transmission, and certainly will update our recommendations as more information becomes available.
Great, thank you. And I think another question for you is, again, we're getting a number of questions about how long the virus survives on surfaces, and specifically, what is the latest information about that issue? Folks have noticed that some of this information seems to be from March, and that only limited sets of surfaces or surface types were tested. Could you talk a little bit more about that?
Yeah, so that's true. There really have just been a few studies in the scientific literature that have provided data on surface survivability of this particular virus. And these studies suggest that the virus can remain viable in surfaces for hours to days, and this really depends on temperature, humidity, and the type of surface that we're looking at. Right now, there are no studies available that have evaluated the risk of COVID-19 infection when coming into contact with a contaminated surface. So we just try to still promote this cleaning and disinfection guidance, and that really can be used to utilize or to lower the risk of your infection. So back in late April, on April 29th, CDC, in collaboration with the Environmental Protection Agency, released some updated guidance to help facility operators and families clean and disinfect spaces that they're in. So this guidance provides cleaning and disinfection guidance for public spaces, workplaces, businesses, schools, and homes, and it falls in line with the Opening Up America Again guidelines. So you can find this guidance on our website, and it should provide a lot of helpful information.
Thank you. And actually, going back to the previous question about recreational waters, so some of the questions in the chat box today are talking about if campers should wear face masks while they're swimming. So I was wondering if you could address that quickly.
Sure. So right now, we really think that it's better to limit the use of shared objects that come into contact with the face, and really try to not have children sharing those. That they're kind of typically can be difficult to disinfect, and so it's better, we think, to just really limit those until we learn more about how this virus can be sanitized or disinfected.
Okay, thank you. So Dr. Fulton, what supplies should camps consider ordering in preparation for opening?
Yeah, that's really important for camps to know what to order. There are several things. Definitely might include soap, hand sanitizer with at least 60% alcohol, paper towels, tissues, disinfectant wipes, cloth face coverings, and no-touch foot pedal trash cans. Those are some supplies you want to have on hand. So you want to have those supplies on hand, but you really we really want to encourage not overusing or stockpiling disinfectants or other supplies, because this can result in shortages of appropriate products for others to use in critical situations.
Thank you. And we've gotten some questions about buses and vehicles today. So wanted to ask, what are some recommended safety practices for buses and other vehicles that may be used in camp?
Right, yeah, it's a great question. A lot of camps transport staff and kids back and forth. So all of these frequently touched surfaces on vehicles that transport campers and staff should be cleaned between use as much as possible, and at least daily. When possible, when the windows should be open to allow for airflow and to improve ventilation. It's really important to space riders out within the vehicles as much as possible to increase social distancing. So skipping rows, only allowing one camper per row of seats is a strategy to do that. We want all drivers to practice the same safety protocols as we would like for the staff to do. So make sure you have proper hand hygiene, you're wearing cloth face coverings, and also the recommendations for cleaning and disinfecting school buses is also available on CDC's website, so you can check that out as well.
Thank you. And also we've received some questions about screening. So, what types of screening should camps do when campers arrive? Right, yeah, very important. Temperature screening may or may not be feasible in camp settings. These screening strategies that camps may consider implementing are provided in CDC's guidance for child care programs. That's up on our website. It's very nice guidance. It's important to note that if the screenings can be conducted at least 6 feet apart or while using a barrier, that personal protective equipment is not needed. Thank you. So another question we received was, what are different models of camps that might lower risk to campers and staff?
Yeah, great question. I think it's important to think about a spectrum of risk, where you could think about the lowest risk in a camp setting would be when small groups of campers stay together all day, each day, that those campers remain at least 6 feet apart and they don't share objects. Outdoor activities would be prioritized, and all campers would be from the same geographic area. That would be the lowest risk scenario. A camp model that presents a little bit more risk than the model I just described would be when campers mix between groups, but then they remain at least 6 feet apart and they don't share objects as well. And outdoor activities would be prioritized, and all campers would be from the same geographic area. So moving up that risk spectrum a bit, even more risk would be when campers mix between groups and they don't remain spaced apart, but that all campers would be from the same geographic area as well. And then finally, thinking about the highest risk in a camp scenario would be when campers can mix freely between groups, they don't remain spaced apart, and they're from a variety of different geographic areas. And then also it's important to note that overnight camps may pose more of a risk than day camps.
Thank you. So we're also getting some questions about, what does local area mean? And when you talk about the same geographic area, could you talk a little bit more about that?
Sure, yeah, that's a great question. We define the local area as being, that geography that can be considered around the camp vicinity. So you can think of it as a community or a town or even a city or a county. But it's that local catchment area for that particular camp. And many camps are often set in rural areas, so it's difficult to know exactly from a geographic perspective But we think about them as that local community, town, city, or county near to the camp itself.
Thank you. You talked a little bit about cohorting campers and grouping them. And so folks are wondering if you could talk a little bit more about, is there a recommended group size? You know, how does that look operationally in camps? Do you have some thoughts there?
Sure. Yeah, great question. Cohorting. Cohorting is really important to, we like to think about it as putting campers together so that they kind of move together all day. So they kind of stay in the same pod with the same group size, with the same campers, with the same staff, so that they move together throughout the camp, throughout the day together. And so you have these pods that kind of stay together throughout the camp. And yeah, I think that's really an important concept to get, to get through to people, that when we contain campers and we contain them with the staff, then they're less likely to transmit the virus throughout the camp vicinity. So basically it's containing the campers and staff together throughout the day. And if it's an overnight camp, containing them as well. And I like to think about them in their little pods.
Thank you. We also got a question in the question and answer box about resources for camps, posters, other communication materials. So I do know that there are a number of resources on CDC's website that organizations can take and use as their own. I know we have a number of hand washing posters, for example. And I don't know if Dr. Murphy or Dr. Fulton, you want to expand on that a little bit, talk about some other resources that might be helpful.
Yeah, great, Malia. Really great question. There, as you know, probably there are a lot of resources on our website, but just to point out a few that I think would be really helpful for people. As Dr. Murphy has already described very nicely, there are a lot of resources on cleaning and disinfection. Also, I think the guidance on schools and child care centers, particularly around the screenings, can be very helpful. There's guidance for park administrators around parks and recreational facilities that could come in handy for camps. When you think about behavioral approaches, really look at the guidance that we have around face coverings and social distancing. I think that's really well done and could be very helpful. The guidance that's out there on managing stress and coping, I think can really help not only campers but their families, deal with the situation. So I think that's a great resource. And then, as Malia pointed out, there are a lot of resources on our website about communication materials and free communication materials that are available, posters and signs that you can use. So I think those are some ideas of resources on our website.
Thank you. And Dr. Murphy, maybe we can come back to the question about swimming. There are lots of questions about if there are recommendations for swimming, and then I think also getting back to the question about wearing face masks while swimming. And I think that's probably a no, but you're the expert, so I will defer to you. And I know we also have some new guidance related to aquatic venues.
Yes, so we've just released a document that's called Considerations for Public Pools, Hot Tubs, and Water Playgrounds. And so this is really tailored to those specific settings. And we do encourage the use of cloth-based coverings in those settings, except for when you are in the water. So we know that these coverings can be difficult to breathe through when they're wet. So that considerations document has a lot of helpful information kind of set in these same 4 buckets that Dr. Fulton just went through. Helping prevent the spread, maintaining healthy operations, maintaining a healthy environment, and then preparing for when someone gets sick. So a lot of the same kinds of messages. So I encourage everyone to take a look at that that new guidance has just come up.
Thank you. And we're getting a few more questions in, specifically going back to the question and answer about cohorts and groups and the number of 10. Is it 10 campers or 8 campers and 2 staff? I mean, I think the answer is a group of 10 is sort of the number we're talking about here. So I don't know, Dr. Fulton, if there's anything else to add. I mean,
it's a really excellent question. Yes, 10 seems like a reasonable number. I think the main point is to try to contain those small groups of campers with their staff throughout the day, and not allow the mixing between the different cohorts or between the different groups. I think that's the key. 10 seems like a reasonable number. And then also, you know, it's also really important to practice these healthy behaviors as well, to try to, you know, to keep with social distancing, you know, healthy hygiene, wearing the face coverings if they're feasible. So practicing all those healthy behaviors in addition to cohorting is very important.
thank you. And I've noted too that we're getting a number of questions that are about sports and youth sports, and I just want to let everyone on the phone know that we're actually having a call on Friday specifically about youth sports, and that will be from 4 o'clock on Friday. And so I would encourage you to join us on that call where we will be going through more information specifically about those activities and youth. Okay, so I think we're also getting more questions about screening. And, you know, should temperatures be taken both on arrival and dismissal? You know, how often they should happen? Is there anything more that you'd like to share about temperature checks and how often they should happen and with campers and in camps?
Yeah, that's a great question. I don't know that we know that. I think it's an issue of feasibility in the camp setting. I think that, you know, it's a great way to screen, you know, in addition to, you know, other symptoms, you know, temperature, as well as, you know, cough and the other symptoms. So I think it is an issue of, you know, doing these health screenings as is feasible in the camp setting. You know, it's also important when the screenings are done to make sure that the screener and the screenee are at least 6 feet apart, or that they're using a barrier if personal protective equipment is not needed or not available.
Thank you. And again, going back to face masks, I think there are also a number of questions about if kids need to wear face masks while they're playing around outside when it's hot. I think there's a lot of concern about it being summer and potentially the heat being a factor with face masks.
Yeah, it is a reality with face masks, and I think particularly for younger children, you know, we would like everyone who cannot social distance, who's over the age of 2, to wear a cloth face covering. But we also know that there is a feasibility factor to consider here. You know, for younger children who cannot tolerate a cloth face covering, or who may be more likely to touch their face when they're wearing a cloth face covering, then that kind of defeats the purpose of the covering. So in that case, you know, it may not be feasible to do that, and we wouldn't want that. There are some instances where the face covering interferes with vision or can fog up glasses. We certainly don't want that as well. So I think particularly with the younger campers, you know, it really is a feasibility issue, even though we do recommend them for people over the age of 2, but sometimes it's just a feasibility issue, a practical issue to, you know, whether to wear them or not.
Right. So just to reiterate that for children under 2, they should not be wearing face masks.
Exactly.
Thank you.
Yes, babies or children under 2, no face mask.
Thank you. I also see that we have some questions referring back to the Friday call that I mentioned, that it will be about youth sports and how do you register for that. So there were specific registration links for each of the calls we're having this week in the announcement that we sent out via email. So if you still have that in your email box, you can go back to it and register for each of the calls that we have planned. Tomorrow's call will be on schools and child care programs. Thursdays will be on workplaces and mass transit. And then, as I mentioned, Fridays will be on youth sports. And each of those calls will be at 4 p.m. So I think that we have a number of questions in the Q&A box on the screen. And I will apologize that we are not able to get to all 440 plus questions today. We do realize that this is a very important subject, that summer is fast approaching, and that camps are a tradition for a lot of families and a lot of children in the U.S., and that you are all grappling with a lot of hard questions and making plans and doing what you can to assure the safety of the children in your community. So I do hope that this call today has helped with that. I would encourage you to really look at the resources on CDC's website. We have numerous resources for communities and settings. We have the resources that were mentioned at the beginning of this call. And then also to say, please check back often, because CDC is continuing to modify and post new guidance as new information becomes available. And so we hope this call today has been helpful. On the screen, there is an email box that you can reach out to if you need a registration link for the next call. We'd be happy to send that to you. Just want to thank everyone today for their time, and especially thank Dr. Murphy and Dr. Fulton and Dr. Wester for sharing your expertise with us today. So thank you very much.